Howdy folks, welcome to another lecture. In this one I'm going to talk to you about the management of airway and breathing. So what does the airway do? Well, the airway is a passage that allows air to move from the atmosphere into the alveoli. So you remember you've got let's see if I can do this. Your little person here, there's their mouth, and their trachea comes down here, and it breaks into two bronchi. And then basically these lungs are attached, and the very final pathway for air are those little alveoli at the end of the lungs. They look kind of like bunches of little grapes, the little air sacs. And obviously this is not to scale at all, but you got your little air sacs here, right? So that the, there's my little guy's head there. I'm not an artist, clearly not an artist. Anyway, the air goes in through the mouth, and it travels all the way down in here, and then it gets into the lungs. So it has to remain patent or open at all times, and anything that blocks the airway will cause a decrease in oxygen available to the body. So remember, oxygen, this silly thing. So oxygen is kind of floating around in the atmosphere. It's little gas, and it actually goes, and that's something that you breathe in. So if you block the airway off, the oxygen can't get in. So if there is an obstruction, the size of the obstruction will affect the available air exchange. So basically air exchange takes place down across the little membranes of these alveoli, and oxygen goes into the bloodstream, and then CO2 leaves the bloodstream. And we really need to have both components. Oxygen of course is fairly important, but carbon dioxide leaving is just as important. So one of the things we want to teach you how to do is actually open the airway. And this is something really that we're going to do manually at first, using something like a head tilt chin lift or a jaw thrust. We may have to suction the airway to help open it, and we may put in a device to help keep it open. So these are going to be patients who are maybe unconscious, they may be intoxicated, something like that, but basically they're not able to open their airway on their own. So the head tilt chin lift is a manual technique that is used to help open the airway, and I want to point something out. So in this picture, the patient's trachea kind of comes like this. The nose, it only goes up a little bit here, and then it actually goes straight back. The passageway does. And the same thing with the mouth here. So the passageway is basically like this. Putting their head back a little bit like this actually helps line up the breathing passageway a little bit more. It kind of curves down. That's a little bit far back. I drew that line. But it helps line up the breathing passageways a little bit. We use this head tilt chin lift when no neck injury is suspected. So if the patient is a trauma victim and we are concerned that maybe their neck back here is injured, their spine is injured, we're going to use a different technique, which I'll talk about in a second. So we're going to say this patient does not have a neck injury. As I mentioned, it's a temporary procedure, but it's something you can do really quick. And you have to replace it with what's called an airway adjunct, unless the patient begins adequate spontaneous ventilation after you move their head back. So you can see in this picture you've got one hand on the forehead and one hand on the chin, and you're basically going to take and move the forehead back this way and kind of lift the chin up a little bit. So like I said, you put one hand on the patient's forehead, apply firm backward pressure with the palm, causing the head to tilt backward. Place the fingers of the other hand under the bony part of the patient's lower jaw near the chin, and you're actually going to lift the jaw up to bring the chin forward. So who needs this? Well, an unresponsive patient who does not have history of trauma, cardiac arrest patients without signs of trauma, and any apneic, which means no breathing, apneic patients without signs of trauma. So that was the head tilt chin lift. The other technique that I'm going to talk about is the jaw thrust. And this is a technique that we use to open the airway in patients who have a possible spinal injury. So, and it's not just when a spinal injury is suspected, it's anytime there's a possibility. Oops, that's an O. Possibility of spinal injury, and I'll abbreviate that there. Again, this is a temporary procedure, just like the head tilt chin lift, and you need to replace it with some sort of airway adjunct unless the patient begins spontaneous ventilations. So how do we do this? Here's what I want you to do. Put down whatever's in your hands, and I want you to take and kind of put your fingers on your earlobes. Start with one finger on each earlobe, and then I want you to come forward a little bit, find your jawbone, and then move your fingers all the way down, and you'll feel where your jawbone basically makes a turn from going down to going forward. That corner is where you want to take and put your fingers, and you want to take and push your fingers straight forward. So you basically push your jawbone all the way forward. What it's going to do, if you're doing it to yourself right now, you'll feel like your teeth, your front teeth, are sticking out a whole lot compared to your top teeth. So basically that's what you do for a jaw thrust. If the patient's lips close, you want to retract the lower lip there with your thumbs. So who needs this jaw thrust? Well, an unresponsive trauma patient, and then any unresponsive patient with undetermined mechanism of injury. If we don't know what the mechanism of injury is, we're going to use a jaw thrust over a head tilt chin lift. So we're not going to use the head tilt chin lift, we're going to use the jaw thrust.